I have questions regarding nicotine and combustion. So the report mentions extensively that nicotine is a widely misunderstood molecule. So can you explain that statement in your own words, Konstantinos?
Well, first of all, thank you very much for the invitation. Nicotine is a very misunderstood molecule because for several decades, the main source of nicotine intake for most of the global population was smoking. So even in scientific publications, you could see titles in studies referring to effects of nicotine, while in reality they were studying smoking. But at that time it was the same. No one else, besides few exceptions like Sweden, which has traditionally been using snus, no one else was obtaining nicotine through any other source. That created a lot of misunderstanding and misperceptions, even among the scientific community, let alone the population. And that perpetuates and propagates until today. Characteristically, in 2017, we did a study in Greece among healthcare professionals and specific professionals working on smoking-related disease, like lung physicians, cardiologists, dentists. And the level of misperception about the contribution of nicotine on smoke-related disease was tremendous. Characteristically for lung cancer, about 80%, a little bit more than 80% of these healthcare professionals responded that nicotine is an important, very important, or extremely important contributor on smoking-related lung cancer. And the same answers were given for the same answer for cancer in other organs and for cardiovascular disease. And we don't need any research on that. We know that the contribution of nicotine is minimal, if any. And we have so much evidence, not from laboratory studies, not from cell and animal studies, but from human epidemiological studies, many cohorts, mainly from Sweden, through the use of snus, which is not a pure nicotine product, it is a tobacco product containing nicotine. But we have so much evidence indirectly also reporting about nicotine, because we know that snus users obtain similar levels of nicotine on a daily basis to smokers. So it's pretty simple to understand that if nicotine was the main contributor to smoking-related disease, we would have seen similar adverse effects from the use of snus or any other form of nicotine product with smoking. But the difference is tremendous. And despite studies on laboratories, animals or cell studies, reporting things like development of atherosclerosis from nicotine administration to mice, these have never been translated into human effects because we have a lot of studies of snus users about their cardiovascular risk, both for myocardial infarctions and for strokes of any origin, thrombotic, hemorrhagic, even unspecified. So the evidence is clear. I don't think that we need more research in understanding a basic concept that the effect of nicotine on smoking-related disease is minimal. I wouldn't say zero, but I would, with a lot of confidence, say minimal. What we need to study is why there is so much resistance to the truth, because that's the truth. Why there is no honesty. Why a simple message that nicotine through a use of a non-combustible product is by far less harmful than nicotine obtained from a combustion product like tobacco cigarettes, why is it not accepted by the public health authorities, by the public health and the scientific community? It doesn't make sense. If you don't accept it, you're not telling the truth, because there is no doubt that this is the truth. We may discuss about the level of risk reduction for different products. And yes, we haven't quantified the level of risk reduction for many non-combustible nicotine products, with the exception of snus. Because for snus, as I said, we have long-term epidemiological studies, we have meta-analysis of epidemiological studies, so we have the highest level quality of evidence. But for other products, yes, it can be debatable. But not accepting the lower harm message is like saying that you shouldn't walk on the streets and look on both sides of the road before crossing the street. You should just stay at home forever. That's the alternative message. I also don't understand why governments, and there are several governments nowadays, are allowing legally the sales of the most lethal nicotine-containing product, which is the tobacco cigarette, and they are banning snus, the whole European Union, nicotine pouches. Many governments, like, for example, Belgium, a few months ago, Spain is about to do the same. Other countries in Southeast Asia, imagine India, the country with the highest rates of oral cancer in the world, because they are using some awful oral smokeless tobacco products there. And they kicked snus out of the country when a company tried to introduce snus into the Indian market. They also, a few years ago, 2-3 years ago, banned e-cigarettes. They banned them completely. But tobacco cigarettes and the lethal local forms of oral smokeless products, they are widely available and they are extremely cheap. It doesn't make sense. What's the message you give to society? It's not honest. It's not the truth. And we need to understand why they are afraid of telling the truth. It's a form of a risk aversion. We cannot accept any risk, which is like living in a different world, because all our daily activities have some risks, and all interventions and changes in behavior are made in order to reduce but not eliminate the risk. Take, for example, all medical procedures and medications. There is no medical procedure and no medication that is risk-free. And there are very, very few medical interventions that result in curing of diseases. Basically, we can cure only some infections, not even all of them. But for the rest of diseases, we treat a disease, which means that the patient will have the disease for the rest of his life. A patient with a myocardial infarction will have a dead part of his heart for the rest of his life. A patient with COPD will always be a COPD patient. But we are treating that. That means we are reducing the inability, the adverse consequences, the decline in quality of life, and the progression caused by the disease. This is harm reduction. So we accept harm reduction everywhere, even in medicine, which is by definition, and with very few exceptions, a harm reduction science. But we don't accept harm reduction for tobacco, for a product that is being used by 1.2 billion people in the world. So we have accepted and we are endorsing harm reduction for intravenous drug users, and there are 16 million intravenous drug users in the world, but we don't accept a harm reduction approach for a product that prematurely kills half of the 1.2 billion users. It doesn't make sense, and I think that, and that's my message, we need to be honest. It's so simple. It's that simple. We just need to be honest.